Unipolar depression is another name for major depressive disorder. The term unipolar means that this form of depression does not cycle through other mental states such as mania. This is how unipolar depression differs from bipolar conditions, as in contrast, bipolar conditions cause periods of both depression and mania. However, having unipolar depression does not mean that a person is depressed at all the time. People with major depressive disorder may experience periods of remission that alternate with periods of depression's relapse. They may also feel happier when circumstances change, especially if they have the subtype of major depressive disorder called typical depression. Unipolar depression is one of the most common mental health diagnoses, as well as producing a depressed or sad mood. It can cause physical symptoms and significant difficulty managing daily tasks and relationships. In 2019, 7.8% of all adults in the United States had at least one major depressive episode. What is it? Unipolar depression is another name for major depressive disorder. This mental health condition affects both mental and physical health. The diagnostic criteria for major depressive disorder are as follows. A person must have at least 5 of the following symptoms. Depressed mood. A person feels sad or depressed for the majority of the day on most days. They may feel empty, hopeless, sad, or uncertain about the future. In children, these symptoms might manifest as behavioral issues or irritability. Loss of pleasure. A person may get little or no pleasure from activities that they once enjoyed. Weight or appetite changes. A person may gain or lose 5% or more of their body weight without trying or experience changes in appetite, such as eating too much or too little. Sleeping issue. A person may sleep too much or too little. Fatigue. A person may feel physically and emotionally exhausted to the extent that it interferes with their motivation and daily tasks. Concentration issue. A person may have difficulty focusing, paying attention, or thinking clearly. Some people may experience brain fog. Thoughts of death or suicide. A person may have intrusive thoughts of dying, harming themselves, or dying by suicide. A person will only meet the criteria for a diagnosis if their depressive symptoms are not due to bipolar disorder or another health condition. The symptoms must cause significant distress and not be due to medication or a physical health condition. The symptoms of depression can also cause secondary symptoms such as trouble getting or keeping a job, relationship conflict, trouble studying or excelling at school, difficulties with self-care. People with depression view the world through a distorted lens, which can affect what they think and feel about other people and themselves. As a result, they may experience interpersonal conflicts, low self-esteem, rejection sensitivity, and similar challenges. The primary difference between unipolar depression and bipolar depression is that a person with unipolar depression experiences only depression rather than cycle of depression and mania, which characterize bipolar disorder or bipolar depression. People with bipolar depression tend to experience periods of depression similar to those of major depressive disorder, but they also experience times of mania during which their mood is very elevated. During manic episode, a person might be unusually happy. They may make impulsive or harmful decisions such as spending too much money. People with unipolar depression are not necessarily always depressed. Some may appear happy, pretend to be happy, or experience times during which their depression symptoms improve. One subtype of major depressive disorder, atypical depression, tends to be chronic. However, it also responds better to change in circumstances, meaning that a person may be happier and experience fewer symptoms when their situation improves. This is not the same as the mood cycle that occur with bipolar depression. Major depressive disorder is not the only form of depression. Other forms of depression that are unipolar and do not involve manic episode include postpartum depression. This form of depression occurs following the birth of a baby. Seasonal affective disorder. This seasonal type of depression typically occurs in the winter. Psychotic depression. This type of depression causes a person to have psychotic thoughts. Psychotic thoughts are those disconnected from reality, such as delusion and hallucination. Causes. Major depressive disorder is a complex condition that has genetic, psychological, social, and interpersonal causes. These factors interact with one another to lead to depression. For example, a person may have a genetic predisposition to depression that trauma or stress then activates, triggering symptoms. Researchers do not fully understand what causes depression, but they do know that disruptions in brain chemicals called neurotransmitters play a role in depression. Antidepressants act on brain chemicals such as serotonin and dopamine suggest that these chemicals play an important role in mood. Some risk factors for developing unipolar depression include certain medical conditions including thyroid disorder, family history of depression, trauma, and adverse childhood experience. Major depressive cause a low and depressed mood. A person may experience the world as primarily negative and be subject to cognitive distortion that affect their relationship, work, and school performance. The symptoms of depression include feeling of worthlessness or guilty, feeling hopeless about the future, being unable to get pleasure from hobbies, relationships, or other previously enjoyed activities, trouble thinking clearly or making decisions, brain fog, thoughts of self-harm or suicide, eating too much or too little, unexplained weight gain or weight loss, trouble sleeping or sleeping too much, low energy, slowed movement or speech, feeling restless or pacing. Various antidepressants can effectively treat depression with the best option dependent on several factors. These include the person's overall health, the side effect the person feels they can tolerate, the subtype of major depression. A person may need to try several medications or different dosage of the same medication before they get relief from their symptoms. Working with a knowledgeable psychiatrist and talking about side effects and their treatment concerns may help a person find relief faster. Psychotherapy techniques, especially those designed to treat depression such as cognitive behavioral therapy and interpersonal therapy, can help a person cope better, implement positive lifestyle changes, and manage life with depression. Electroconvulsive therapy, vagus nerve stimulation, and transcranial magnet stimulation, which are therapies that directly stimulate the brain, may also help, especially if other treatments prove ineffective. Some people find that they benefit from making lifestyle adjustments such as exercising more, eating a well-balanced diet, practicing meditation, or start a new hobby.